Hi, everyone. I'm Lisa Catalano, a clinical social worker and a midlife well-being coach for physicians. I'm so excited for today's discussion and want to welcome you all here for what I know will be a rich discussion. I'm delighted to introduce Dr. Mark McGinley, a prolific pulmonologist and critical care physician who recently retired after more than 40 years in practice, most recently at St. Mary's Regional Medical Center in Grand Junction, Colorado. He's kind enough to be joining us today from his home in Paris, France. There's no envy there, Mark. Earlier this summer on my series Unscripted, A Physician's Journey, I had the privilege of interviewing Mark, and he spoke so candidly about stepping away from medicine and learning to simply be. We had some technical glitches during that particular sit down, but I'm entirely optimistic about this one today. And we're going to build on that conversation and talk about his book, Critical Relief, a CEO's Guide to Transforming Hospital Culture. It's a concise playbook for hospital CEOs and administrators about repairing the physician-administrator relationship to improve outcomes, restore trust, retain talent, and build patient-loyal, mission-aligned organizations. Mark, I'm beyond grateful to have you here with me again and for all of your patience with everything that happened the last time. This is really a compelling and richly informative work, so I really want to delve in if that's okay.
Sure. Thanks, Lisa. It's great to chat with you. And there's probably lots of angles to look at the work or the book from, but it's good to always have a platform. And thanks so much.
Yeah, I'm so excited. And I read it in 2 hours. That's how good it is. It's one of those you can't put down. I'm wondering, Mark, what ultimately galvanized you to bring this book to life?
Yeah, I suppose I've always had this idea that, I would be engaged and it would be a very enjoyable experience to write a book. So there was that lingering, and I'm like, gosh, I'm getting older. Are you ever going to write a book? And then I'm wondering what would it be on. But then I began to realize that as I was encountering a lot of change in healthcare and frustrations amongst my colleagues, and then being taken over by a big system myself in my own personal experience, that was sort of the seed I needed. There's been so much change in healthcare. There's been so much talk about physician malalignment of values with corporate healthcare and physician burnout and shortage of physicians. That to me felt like a rich kernel to start a book about. And not much has been written from the physician's perspective about this issue in terms of what I saw as poor customer service. I love the issue of customer service. It excites me when I see it in action. And I really felt that this would be a novel way to look at the dynamic of being a physician employee and what's the customer service like. And it sort of started as a sit down and start writing type of thing. I was very lucky to have a good editor and coach along the way. Wisdom Press publishers guided me, and I really had to lay out my stuff and be sort of thoughtful to who my audience was and all those pieces that you learn when you write, to be to sort of tap into the productive creative juices, so to speak. I really needed that guidance, and it was great. It actually took me 2 years to write it, but that was the impetus, really being taken over by a big corporation.
You talk a lot about, I actually highlighted so much that I'd love to read out loud. But one of the questions I'd had for you, you talk a lot about the breakneck changes in healthcare in your book. And I'm wondering if you can, just to ground us, if you can share with us what some of those breakneck changes are that you're referring to that I also think contributed to the authoring of this book, right?
Yeah, one big one is in 2020, the US government came up with this: we have to computerize the way we document and bill. And they started to, by 2015, impose a 1% penalty on hospitals that wouldn't be digitalized, so to speak. And this was the birth of the electronic medical record. And this changed a lot of our culture in medicine. We now had to be the unit secretary and put in our own orders. We had to do our own reconciliations. We had to now answer emails with patients. We had to type our notes. It was just a total disruption of the flow of how we used to do things and how we used to communicate. So that was one thing. The second thing that happened is I think it triggered a lot of physicians who just couldn't do this on their own in private practice. So they started their practices started aligning or being bought out by hospitals, and you started to see this phenomenon of where physicians became hospital employees, and that's a huge change too. And now 75% of physicians either work for large healthcare corporations or large institutions. So that also, the corporate world was a huge adjustment for us as physicians. So I think those were the two things, the electronic medical record and then the gradual fragmentation of private practice and the consummation or the consumption of all these doctors into big organizations owned by massive healthcare corporations.
I wonder what do you think physicians have come to expect now? So if you're working for a larger institution, what do you think that, the expectations are for docs starting?
Yeah, for me, that's I think why I wrote the book, because I I suppose I came up through the classical approach where, you were listened to, your ideas were elicited, respected. There was an open door approach with the administration. You were all sort of very collegial and very well connected. Multiple times you'd meet each other at meetings, and and the communication was human. It was a personal connection. Now your orientation is mostly computerized. There's very little human contact. It's all this, do it online. Maybe that's a norm now that we just all have to expect. No one writes notes anymore, so you now have to use all these templates, which are totally impersonal and give no sense of nuance and idiosyncrasy to the uniqueness of the patient in front of you. They're like 20-page dumps of computer information that it's hard to really figure out what on earth's going on. It's like a shopping list and 10 bullets per problem, and you really don't know what's the most important problem. So I think people have come to expect that now. Now physicians really don't have a connection with the CEO. They're managed by like administrator groups that are sort of siphoned off from the CEO. And these groups may not even be part of the hospital you work in. They sort of pop in for a meeting and go to another place. So it's a really different world. But I think these are the norms now, and maybe the next generation of physicians are okay with it. But the stats would say not so. The millennials and the Gen Z, they're experiencing burnout too. And that's all they know is the digital world. So I think we can expect it, but I don't think we should accept the humane consequences of this sort of new way of interacting. From my personal perspective, I'm a glass is always half full type of person. I'm definitely an optimist, but this doesn't have a good trajectory in my opinion. I think already the American College of Medical Associations predicts that by 2029, I think, there's going to be about 100,000 physician shortages throughout the country. Mm-hmm. So what you're getting is early retirement and sort of cold quitting in a way. Physicians they're not volunteering anymore for committees. They're just punching the card and going home, which really changes the culture of the hospital. So you basically start to feel more like like the Duracell bunny. You just stay in your lane, do your work, punch the thing and go home. And we are, by definition and by our attraction to medicine and our training, we are intellectually curious, we're go-getters, we're we like to lead. We have a lot of intrinsic qualities that pull us to this type of job, and this environment is a sort of, from a soul or a nourishing perspective, it's a death sentence. So I think burnout will continue. You can't fix burnout with an app. You can't fix burnout by buying pizza and taking people to lunch, or telling people to join the gym. That's not the problem. And if burnout is 65% across all specialties, then we have a system problem. It's not just a critical care medicine problem or an EORM doc problem. It's a system problem. So I think these healthcare corporations are incredibly financially profitable, but I think from a culture, the physicians are becoming more and more marginalized, and that won't play out well. I think you're going to lose more and more of the lifeline, the vital lifeline of what keeps a hospital at high quality is the quality of their physicians. And if you've got less and less, your expenses go up. There's more and more recruitment. There's less and less retention, and so it goes. But from a personal perspective, I think it's incredibly narrow-minded to think that you can take these highly trained people and make them perform like this and expect it to play out well. I just think you have to go backwards to more open communication, more transparency, more what are your thoughts before decisions are made, and more of a real partnership and collegiality, which is sort of dying quickly in the corporate world.
I am thinking back to our interview last month, and you talked a lot about how this impacted your own decision-making around your career trajectory. And I'm wondering if you could share some of that. I know you had some really difficult experiences at the very end of your time as well.
Yeah. So I started medical school in 85. So if you consider medical school, I've been in this world, this bubble, this practice of medicine for 40 years. And I'm now 64, and so I don't really need to retire. I could go on for another 5, 6, 7 years or more if I wanted to. And to some degree, I struggle with the idea of retiring. But I must say, I felt like the joy wasn't there like it used to be. The skip in my step wasn't there. I felt like I was just doing the function, doing the role, and the satisfaction, it just didn't feel like I suppose I just needed more connection and enjoyment and appreciation and all those things that I was missing. And I'm like, there's a lot of things that one can do in one's life. Maybe it's time to just sort of turn that page and enjoy closing that chapter and seeing what happens afterwards. I think I was the medical director of from all feedback, a very high functioning ICU, and to see what happened to our ICU after a corporate takeover was extremely sad for me. All of the good ICU docs left. We went to remote care at nighttime. It was just a lot of things that just sort of gutted me. So then I started working with another big healthcare corporation in Colorado. And while I enjoyed my colleagues, there was a lot of the same sort of cultural, we don't really care what you think. This is what's happening. This is coming down from the head office, and take it or leave it. And so to me, it just seemed like, maybe I'm just not cut out for that type of culture. I think it just doesn't resonate with me. It's time to stop. And so that's sort of what made it a good time for me. So having said that, and speaking to some of my younger colleagues, the conversation's not that different. They're all talking about stopping earlier too, because it doesn't doesn't fill your soul, this type of assembly line production corporate culture. It just doesn't work for human beings in the world of healthcare and medicine and critically ill patients and being judged by, RVUs and other metrics. And, you're a good doctor because you hit these titles. Like, that makes not, it doesn't resonate with physicians. That's almost demeaning to us.
I have to say that in my coaching practice, the number one pain point that doctors come to me with is it's all middle-aged doctors or midlife doctors who are saying that there's been such a shift in the healthcare system that they feel like widgets, and it's no longer, providing the same sense of purpose and passion that they had. But they also don't know what else to do, right? They're stuck in this ambiguous place of being, concerned about what life is there for me out there. I've only been a doctor, and how do I stick this out until it's time for me to leave?
It's like the pain of leaving or the pain of staying. It's a sort of an existential dilemma, because you're good at what you do, or by this stage of your career, you should be good at what you do. You should be comfortable, yet it's not very satisfying. You feel like you're being herded around like little robots.
So, Mark, if we're looking to begin to initiate change, where do we even get started?
Well, my book is really about customer service from the perspective of the employed physician, and so my thesis is that if you provide, it's sort of like internal customer service, if you provide good quality service and great customer care to your primary customer, which I define as the physician, then that person will provide good care to his or her primary customer, which is the patient, and it's a win-win. This isn't novel. This is something that most corporations get. In fact, the quote from my book is from Sir Richard Branson that says, that employees are our primary customer. So to begin, I would say provide excellent customer service to your physicians. Now, you may think you're providing excellent customer service to your physicians, but you may not know that actually they're very disillusioned, unsatisfied, burnt out, or whatever. So I think it requires sitting down, the middle and upper management sitting down with their physicians, and not just talking about metrics, but talking about what are we doing right, what are we doing wrong, why are you feeling this way, what can we do to make it a much better culture and experience here. I think that's where the change should start. It's not a one size fits all. It's unique to each hospital, and you need to sort of take the pulse of your physicians and go from there. But you really got to have that cultural or perspective lens change where actually our primary customers here, if we're going to get this game right for the long run, are the physicians.
What do you think has been the biggest barrier to even becoming a thing that you bring to the boardroom and start a conversation about?
It's a good question. If you're making a lot of money and things are going well and everyone's getting bonuses, you don't want to rock the boat. I'm being a bit cynical, but why open Pandora's box if we're getting great patient quality care satisfaction surveys, we're making X million dollars profit a year, life is good. So being successful may be an impediment to having that conversation. Maybe being unsure how to do it. Maybe being scared and not trained how to do it is part of the impediment. Maybe you'll be appreciated or perceived by your higher managers as being a softie and being too compassionate. Maybe that's an impediment. I don't really know. But if you continue like this with more and more burnout, more and more disillusioned, sort of marginalized physicians, the writing's on the wall as far as your long-term recruitment and retention.
So one of the tactics that you actually refer to in your book is using motivational interviewing as a tool to start the conversation. And I'm wondering if you could share some of your experience with that, or how you think that might be beneficial, what it is.
Yeah,
For people
I
who don't
wasn't
know.
taught about that in medical school, and actually, it was only when I did a fellowship in integrative medicine at the Andrew Weil Center in Phoenix or Tucson, Arizona, that I discovered the value of this, and so I started to apply it in my own practice. And I actually was very impressed that, all my efforts of being logical with patients sometimes would amount to zero. They just wouldn't be compliant, or, you could see they're not going to change. But I'd had some amazing sort of behavioral changes by using motivational interviewing. And essentially the theory is that if you get someone to actually articulate it inwardly from themselves, and you don't sort of impose it from the outside, that they sort of own it, and there's a much better chance that it will affect their behavior. And so it's a few questions. I think it's a total of 8 questions. And you ask, do you think there's a problem? Are there any advantages to sort of staying the way you are, or any advantages to changing? What do you think might happen if you don't change? Have you ever been successful at something in the past that you really didn't think you would be? Questions like that. And you sort of, so from a management point of view, if you've got a group of physicians or a group of your managers that you're trying to improve customer service with, they're like, well, we don't know how to do this. Then you more or less give them this approach. Okay, so let's see. Do you think we're doing a good job with customer service in our hospital with our employed physicians? Oh, yeah. Or do you think there's any problems? Well, maybe. Well, how do you think that might play out if everything stays the same? And then, would there be any sort of likelihood that it could change? What would need to happen? And you more or less get them to articulate the inner solution. And then the management starts to buy into it, and they feel like, we're very clever. We came up with something really brilliant. And they did, because you didn't impose it on them. So this is the technique of motivational interviewing. And right. I personally, from a clinical perspective, have found it to be the most effective way to change behavior. And if you're trying to change behavior from the top down, a CEO needs to get the management team on board. And I personally think that this is a perfect strategy to use.
When you think about it from a patient's perspective, because I think that's a big piece of what you're talking about also, that this would improve patient satisfaction and also quality of care.
Yes. There's lots of studies showing that burnt out physicians deliver poor care. That's like, I'm not going to, it's all in the book if you want the studies. But so really, in healthcare, if you're running a healthcare hospital or 50 of them, you want good patient outcomes, you want happy patients, and you want happy employees, and you want some margin of return on your investment. But you can have this helping the doctors help the patients have better outcomes, and everyone's more satisfied by focusing first on the doctors. It's no secret, or maybe it is, hospitals don't have patients. They don't. There's no patients in hospitals without a doctor who admitted that hospital didn't admit the patient. It's the doctor who admitted the patient. So if the doctors aren't happy and are leaving and you're short of doctors, it's going to have an impact on your patients. You're going to have fewer patients, or you're going to have a rotating sort of no consistency, just, temporary docs and everything. And so there's multiple variables that can impact patient care, but one of the most basic is a steady, loyal, happy workforce. And so there's the low hanging fruit, if you will. Get those employees fired up, happy, content, feeling like they're working for the best system in the world, and the joy comes back into your work. Physicians aren't afraid of working hard. We have worked hard, our whole training, everything, but we can't function well in an environment that squashes you morally or from the spirit or from your sense of being appreciated and recognized. These things are so important to getting that culture right. And I think that's the gist of my book, is focus on that problem first, and everything else will fall into place.
It's interesting because I've noticed a lot of complacency among the physicians I work with, especially where they'll say, this isn't working for me. We're kind of getting through the day. Our patients are getting their needs met. What's the point of me speaking out? Nothing's going to change anyway. How do we, based on everything you've just said and the benefits that we've been talking about, as putting the physician as your primary customer, how do we create that culture change? How do we create
No,
that
what you
shift?
say is very true, Lisa. There's this label of a disruptive physician. We're all employees now, and if you squeak the squeaky wheel, if you just don't play your cards quite right, you feel like you could get fired. You're disruptive, and then that gets into your record, and it sort of travels with you. And so there's a bit of fear involved. But if you go to the physician's lounge and listen to what they're talking about around the table, it's the same. It's a variation of the theme. That everything's the same. Like, can you believe what's going on here? We weren't even asked. Now we have to do this. This is just ridiculous. We have got so many blah blah blah. So there's this disconnect between we're really unhappy, but we're not speaking up. And that actually was the reason I wrote the book, because there's no one writing about this from the perspective of, no, the primary customers should be the physician. Everyone's the primary customer is the patient. Let's do everything to make the patients just need to fall in line. But I think your question was, how do we do this? How do we empower physicians or get them to speak up or be more honest? That's a great question. We all practice a little. No one wants to sort of destroy their career, and they're a little bit timid to rock the boat. But I don't have an easy answer for that. I do think that getting dynamic physicians together who can articulate this well and sitting down with management is the beginning. And then having this as a topic for a medical staff meeting. There's no other agenda except how do we improve customer service here? We are sincere. We really want to do a better job. We've heard from you. We've heard from your leaders. Let's brainstorm this. I think that's one way of starting it. Those sort of town hall type of medical staff meetings where that's the focus. We're running out of physicians here. The culture is a bit toxic. How do we make it better? And now you're not a disruptive physician. You're a team.
I think you're so right that so many docs are afraid of having that label of disruptor slapped on them. And, but I also think that there's a lack of awareness that it seeps out in their day in terms of how they're interacting with potentially other colleagues, with their families when they go home at night, with their overall life satisfaction and, of course, job satisfaction. So this is such an important topic.
I suppose my book might be, if anything else, a catalyst for that conversation.
I have to say that the reviews are phenomenal. And it talks about boosting organizational profitability and customer satisfaction, empowering authorities to seek out working with you and for you. I'm wondering, I feel like Vanna White. But I'm proud of it. I'm so proud of it. And I'm so grateful for you to be here with me today to talk about
it. I suppose you're in your own echo chamber. My colleagues who've read it and know me, they think, this is great. And I've had some, on Amazon, you get those feedback things. And I've had some people I don't know said they walked it straight into the C-suite and, blah, blah, blah. But, you really don't know if it's having any real traction or impact. I don't think I can change the world of healthcare in the United States by getting people to read the book. I think it's if you read the book and it resonates and it makes sense with the culture and what's going on in your hospital, then it's how do you have your own unique conversation. And if I even had one hospital system that said, we read your book and this is what we did and it made a big impact, I really think it'd be great. But I don't know if anybody or anything has happened like that. And, I really wrote it for my my inner sense of peace. I really wanted to get this all out there because I wasn't out there just on a moaning and complaining mission. I'm out there. It's basically a solutions based book. It's like, yeah, we have these problems, but they're so human. They're so obvious. This is the way to go forward if you really want to thrive as a healthcare system. And sometimes books take a while before they get traction. I wrote it not quite a year ago. In September, it'll be a year. So there's still the small hope that it might become prescribed reading at MBA courses for those doing healthcare management. That would be, because right now I think a lot of the CEOs who manage hospitals aren't doctors. And in a way, there's a slightly different lens that they look at things through. I think this is important for everyone in management to read it from a doctor's perspective so that they get a little bit of insight as to why we do this work and why we're having these huge across the board burnout and dissatisfaction issues. It's not too difficult to understand once you see what I'm saying. I don't know the exact percentages, but I think about 7 or 8 years ago, 15% of the physician workforce were millennials, and so clearly that's probably 30 or more percent. So I'm what am I, baby boomer, and then after that is Gen X, I think. But so there's a lot of generations of physicians affected by this. And you could say, if you're a corporate type of person, well, we just wait another 10 or 20 years, there'll be no more moaning, and all those people will have phased out of the system. But I don't think it's that simple. There's studies showing that millennials and Gen Z are feeling the same sense of alienation and burnout, and they're all coming through the computerized age. So it's not that simple. So everyone's going to have to come to terms with it. And I think the work you're doing is very helpful because, if you're good at sports, you have a coach. If you're good at public speaking, you have a coach. And so if you're good at medicine and now your whole world's changed, you probably need a little bit of a coaching sort of guidance and assistance to figure out, how do you re-engineer yourself? How do you find meaning and purpose again when they've changed the playing fields, or they've changed the rules, or they've changed the room in which you play? Doctors are very, very flexible. They've come through incredibly testing environments, and so we are able to re-engineer ourselves. But I think you probably need someone like yourself to help these mid-career physicians who are now suddenly realizing the joy's gone, that the rules have changed, and if you can't change the rules, how do you function in a different system? And my book, my philosophy, I'm not trying to change the rules. I'm just trying to change the way we. I can't change the medical record and the technology of electronic health records. I can't change the reimbursement system. None of these things I cannot change. But I certainly believe we can change the way we provide communication, appreciation, and interaction with our most important customer, which is the physician. So, that to me is definitely as important as to re-engineering yourself. We've got to work on the culture.
In your book, you talk about a values misalignment and how to work around that, because the administration has a vision for what the direction that healthcare is taking, the current healthcare landscape, and where they want to go with it. And then within that ecosystem is the physician that's working, and they may have a different value system or needs, especially at mid-career, midlife.
Yeah, I'll just say a little bit about the values that can be at odds, and then some ideas. I'm not sure that's the easiest thing to fix. But, doctors like to spend time with their patients. They like to talk and get to know the humanity of the situation. They like to problem solve. They like to be helpful and connected, and all of that takes time. But that's what floats our boat. That gives you a buzz. That's what's important. I'm not sure seeing 40 or 50 patients a day gives anyone anything except a headache. It's too much. Whereas, so that's our value system is to do no harm, to provide compassion, to provide a listening ear, to teach, all of those. We get a problem solve, all of that. It's the humanities and science and a little bit of detective work brought into a beautiful career. That's what floats our boat. Now, the administrators who didn't go to med school and aren't in healthcare with the same lens, they're more interested in how do we grow, how do we tap into new markets, how do we become more profitable, how do we become stronger and leaner and meaner, and all those things that make them a more powerful or a successful healthcare corporation. And that boils down to, getting a microscope and looking at physicians as how productive are they, how disruptive are they, how efficient are they, and, all these metrics that get generated. So this is the clash of values, really. This is the malalignment. And your question is simple but profoundly difficult to answer. How do you stop, or how do you do a dance with those different values that can be a good dance, and everyone's like, wow, they dance well? I don't know. I haven't totally got an easy solution to that, but it keeps coming back to listening to each other, understanding each other, having some empathy, really looking at the problem from multiple sort of perspectives, and trying to find it's like a marriage. It's like whenever you have a disagreement, it's like, what's the compromise? Everything in life is a compromise. And so, for example, I'm at Alliance Française in Paris right now, trying to learn French. The other day, a lady came into the class and said, we're thinking of redesigning the library. And this may sound like the most stupid example, but we'd like some input from students who use our library to give us some ideas as to how we can change the library. Now, this is all in French. If you'd like to meet afterwards, there will be coffee and you'll get a little prize for participating. And there were like 20 good souls who came to the library, and we discussed how to make the library better, in terms of soundproof areas and cushions and this and that and this and whatever. And at the end, we got a little tote bag, and we all were happy, and they were very happy. They took down, it was a brainstorming session. They took down 30 different notes and everything. We need that in healthcare. I can't tell you how many times these decisions come down the pipe, and we haven't even been asked. In the past, we used to be, but now we're irrelevant. And that's what I'm talking about.
I think it's also about getting their attention and getting them to see that there's value for them too, for the whole institution, right? Which I think your book.
No, and they were like, they had so much new material. Everyone had a different idea, and some people's ideas were like, wow, that's brilliant. And so, right now what's happening is, if you're part of a 50 hospital system, it seems like there's some committee up at the head office in Phoenix or in Salt Lake City or Boston or wherever it is, and they've got a great idea, and then it's just executed all the way down the ladder. And the people at Hospital Y in the middle of Timbuktu, so to speak, like, this won't work. Why didn't they? And it's it's incredibly demeaning and sort of humiliating to be just treated like that. And I think that gets to customer service.
Critical Relief, a CEO's Guide. I highly recommend that. Whether you're a chief of a department or considering a leadership role, friends with people in the C-suite, I highly recommend that you purchase this book, read it, take it in, share it with your colleagues. Really, I think the other piece of what it does is it makes it okay to not be okay. You validate the very, the internal struggle that so many people have, so many physicians have.
The docs who've read it all give me good feedback, but the thing is, in this world, it's very hard to get with the background noise in the digital world, it's very hard to get your message across. And I am not an influencer or a fancy marketing advertising type of person. And so I didn't want to put all my time and energy into that. I just wanted to be more sincere in getting the book written. But Yeah, it's sometimes don't know if you could get the message out to just one of the right people, it might make a difference. You just don't know.
Well, I hope this does it, and I think it deserved the time and attention. I hope that, after hearing you talk about it and hearing your thoughts and ideas in this little time together, that folks go out and purchase the book and bring it back to their institutions. And I think you do a beautiful job too. Everyone's about what's in it for me, and I think you do a beautiful job demonstrating how this would help the hospital system as a whole, the healthcare system as a whole. So that it's not just about physicians, but it's about, we start with the nucleus, which is the physician, and then how that has this ripple effect to benefit everybody. You're very generous and neutral. And even though the focus is about the physician, I also think that you take into account everybody's role and how we can all work synergistically to really create a healthy setting for patients, physicians, good, healthy, profitable institutions, CEOs that are leading with compassion and with engagement. So I thank you for this. I thank you for your time.
You are part of the solution of what's wrong in healthcare as well, is people who understand and have the passion and heart for this work. This is important. And while I've found a solution by retiring and closing that door on clinical work, there are thousands, if not tens of thousands, and maybe multiples of tens of thousands of people who are not in that position and struggle a lot. And yes, the book can help the culture within an organization, but sometimes we need a little bit of personal help.
Thanks a lot, Mark.